But never to be outdone, our very final carrier in the ACA lineup today is Cigna. Hello, Natalie. Thanks so much for joining us.
All right. Well, thank you guys for having me. Natalie Milas here, the broker manager for Cigna, representing this national training, and here to be your go-to for all things Cigna ACA 2023 and answering your questions, right? I'm going to share just a little bit about me, just so you know, the voice you'll be hearing for about the next hour, maybe less. Try to keep it short if I can, but effective. So living in Chicago, last 3.5 years, which is just as long as I've been with Cigna. So recently came to own this relationship. My manager used to be the main contact for all of you, Nick Ciopa, and he actually became my boss recently. So, my role consists of a nice mix of managing some large national accounts, right? And then I manage 7 of our 16 states, which we'll get into a little later on in the presentation. So, a nice fun plate for this upcoming OE, and I appreciate you all making the time to have me come on a Friday, since my schedule was really limiting the last couple of days. And, I just think we saved the best for last anyway, and you're gonna leave your ACA University just thinking about Cigna, right? All right, let's dive in. So, I know there's fluff in carrier presentations, guys. I get it, but I drank the Cigna Kool-Aid 3.5 years ago. I obviously want you to as well. And I just have a few call outs with these, very standard slides that we always start with, right? So feasting your eyes on community involvement, you can read the bullet points up there yourself, right? I just like to zone in here with Cigna being a brand name that you can trust, right? There's really 5 big insurance companies in this country across, commercial, Medicare Advantage, the big guys, right? We know who they are. Cigna's not the biggest and the baddest of those top 5. I get it. But we do have a great brand name, and we do really zone in on putting that customer first, doing right by them at the forefront of everything we do. And I've seen it and I believe it, right? The company reputation is there. And in certain states, new states existing, just the Cigna name sells for us, right? That matters. And depending on the market, they almost crave us either coming in or still being there, right? Prime example last year with Pennsylvania, we came in, they were like, thank God, a brand name. In Indiana this year, I'm starting to get the same reaction, right? So really just zoning in on that. Taking it a step further. So value for your clients, right? I use this slide to call out the 24/7, 365 customer service, right? The extensive expertise we have to understand our 190 million Cigna customer relationships we have around the world, right? All important things. I also just like to zone in on one, the Cigna employee a little bit and just how we give back. So when I interviewed for this company like 3.5 years ago, every single person that interviewed me in this lengthy process had some customer story to share, or they went out of their way to help a client, even like at the almost executive level, right? And that to me just spoke volumes to who Cigna was as a company, right? Doing the right thing and feeling that just passion and love for helping people, which you honestly just don't really see that much, especially on the carrier side. Other call outs, right? We talk about claims, we talk about, doing again the right thing, right? I wouldn't preach this from the mountain for, the head of our company to hear, but in general, like Cigna pays claims, right? Like we're kind of known for it. Hassle-free claims process sometimes is the tagline we use, and like honoring them, right? Even if maybe Cigna didn't mess up, but the client did. A nice call out is, last year in December, a Utah client they went in and they saw a doctor that wasn't going to be effective in our network until 1/1/2023. Obviously, they got billed. Broker came to me, customer was upset. I went to our claims department and they were like, you know what, that's an honest mistake. I see how they did that. We'll honor it. We'll pay this claim, easy mess up by the customer. We get it. Just stories like that, that I think really show who Cigna is. One other call or give more on the, broker side. I had a broker call me last week about a client that needed their prior authorization escalated because they found out they had cancer and they wanted to have their chemo treatment begin ASAP, right? Like on Thursday. They were very upset, understandably wanted to get in there, right? I escalate this PA. I say, we need to get this guy in sooner. What can someone do? Broker calls me the next day with the customer by his side, almost in tears, that we were able to get that prior authorization escalated for them to get care ASAP, right? So those are just the two stories that I like to share when, again, hyping up the Cigna plus, I guess, guys, and why I really believe in this company. All right, so value for you, right? What do we got? I mean, broad product portfolio, we'll get into robust suite of educational materials. You know the drill. I just like to zone in here on having support from obviously me, as the broker manager. I'll have my email up at the end. Just feeling like you can come to me if you have questions, things like that. And then also a broker support team. That's just a nice go-to for you during open enrollment, especially if there's any technical issue you're having, whether it's a payment issue, maybe something like that. I always preach utilizing broker support. All right, our agenda. Gonna go quick in certain spots, focus a little more on others. But you get the gist. Hopefully we'll be out of here in the right amount of time. So member value. So open enrollment 23. What do we got? So Cigna's committed to growing, really growing. And the fact that we committed to Wall Street, we're doubling our membership and our footprint as of last year by 2025. And you see that with how we're adding 3 new states every single year, right? Jumping over to the right. New $0 benefit options. So, I heard this called out a little bit with already what you've seen on other carriers, arguably becoming the norm. The thing with Cigna is we dip our toes into things and then we do more of it, right? You see that sometimes with the footprint we come in with in certain markets, maybe the network, and that goes along with $0 benefit options as well, right? Last year, you started to see us have some $0 med deductible plans. When I get to my plan highlight slide, you'll see there's a lot more $0 features popping up across the board. Improved rewards. Also heard the call out as I was joining on all the reward programs everyone has. Just checking off, that we have it too. And I think, when we get to that slide and you hear how I sell this program, I think it can be incredibly effective for retaining customers, getting new ones, combating premium complaints, right? Oh, my premium went up $10, or oh, I love Cigna, but Ambetter's $15 cheaper. You can use your reward program to combat that difference, right? All right, let's move on. MyCigna.com, MyCigna the app. The first experience any new customer should arguably be having with us. I want to make sure you guys are calling out MyCigna with your Cigna customers, right? It's making your lives easier, their lives easier, because it really is the one-stop shop where they can do everything that they need. So search their doctors, search the formularies, view prescriptions, view their plan, pay claims, pay premiums, use virtual care, right? Go into the rewards program, and calling out while on this slide where to go for that, right? So you see wellness up there. That is where you would encourage clients to go to use our rewards program. One last thought on this slide. ID cards, okay? So in general, Cigna sends their ID cards about the end of December for those November enrollments, maybe early December, right? Closer to end of January, early February, for the end of December enrollment, and obviously the January one. Speaking to that, because it's important for someone with maybe a January 3rd doctor appointment to know where to get their ID card, right? And it's through mycigna.com or the app. The app's even better because you can just have a nice digital version of it right there. And just a little fun fact with Cigna and why, they're trying to make it easy to get ID cards this way. Cigna employees on Cigna plans don't even get ID cards mailed to them. So it's great that we're still doing that and continuing to do that for our ACA customers. But this is a nice segue to addressing something that might have come on your radar recently. So while we send ID cards during open enrollment, the first half of the year, Cigna does stop sending ID cards now to ACA customers about halfway through the year. Okay, so if you possibly did a Cigna enrollment within the last 2 months, they wouldn't be getting an ID card. Okay, the intent with that, right, is open enrollment's around the corner. This is a very new customer. We want them to just renew then and stay with us, and they'll get their ID card then. So once again, knowing where to go for the ID cards virtually is important. Speaking of virtually, let's talk about Cigna Virtual Care. Another one where every carrier under the sun has this, right? COVID made virtual care an even bigger deal. I myself have had the pleasure of utilizing Cigna Virtual Care twice in the past year and had great experiences. So that being said, you know how it works, wherever, whenever, however, 24/7, 365, you can read the slide. It's important to understand the carrier nuances of their virtual care. So let's look at ours. All right, so we have urgent care. We've had this one for a while. This is at $0, okay? So $0 urgent care. See the examples up there. This is where I used my urgent care for when I had strep throat back in April, right? Nothing you go to the emergency room for, but saving you a trip to an urgent care maybe, and that out-of-pocket cost and that copay. Also $0 is the $0 wellness visit. So this is getting your annual PCP checkup virtually right at home, okay? Now, new for 2023, we have routine visits. So this is where you go in, right, for if you have to go into your doctor every other month, something like that, you can do this virtually too. You can see the examples of how you would maybe use something like this, okay? A lot of love I'm getting from brokers on this one is the prescription refills, because we all know how annoying it is when we hit that point with our medication. Got to go back in to see my PCP to get this prescription renewed. This eliminates that hassle, and you can do it from your home. Calling out with the routine visits, though, you can see it up there. So unlike urgent care and wellness visits, which are $0, the routine visits are going to be at the same in-person PCP copay as the plan that they're on. Moving on to dermatology and behavioral health. We had these new last year. They are back at it again for year 2. Okay, this is going to be at the same in-person specialist copay for each of these as the plan that they're on. And you can see the examples up there. Behavioral health is huge in this country right now. I'd love to talk to my therapist right out of my bed, right? Dermatology, that's another one I had the pleasure of using this year. I had to send a picture in of the rash on my face. And within, honestly, like 2 hours, the derm got back to me with my diagnosis and sent the prescription I needed into the pharmacy for my roommate to go pick up. Really nice and easy. All right, let's hop out of virtual care and into the land of pharmacy. So starting with some old and then hitting with some new. Cigna and Express Scripts, right? They've been under the Cigna umbrella for about 4 years now. We love to preach home delivery. right, as our go-to for that pharmacy service. Now, home delivery isn't for everyone, and I'd like to think retail is a way more preferred. So what's the scoop there? Do you see the Walgreens Advantage network up there? Okay. We used to have a national network, if you remember, right, for pharmacy, meaning you could go anywhere. Now it's changed, right? We have the tagline, the Walgreens Advantage network. Now you're probably like, okay, Natalie, is this Walgreens only? No, it is not. Okay, so with this network, they can actually go to Rite Aid, to Walmart, to Costco, to Sam's Club. Think about local grocery stores, maybe a Kroger, a Publix, Safeway. I'm from Pittsburgh, Giant Eagle. Okay, so it's really not just Walgreens. And if you think about what I listed off right there, there's only one big name really missing from that list, and it's CVS. And this should make sense to you, given their relationship with another carrier. So with that being said, there is going to be a pharmacy lookup tool available in my Cigna for customers to search for pharmacies. Basically just letting you know that it's almost every name you could think of besides CVS, right? And that's what you should be telling the Cigna new and existing customers. Moving on down, we have the Patient Assurance Program, which is back again for, I think, its 4th year. So with the Patient Assurance Program, this is where they'll pay no more than $25 for a 30-day supply of that preferred insulin. You can see the names up there on the screen. Metformin should also, arguably be up there. The Patient Assurance Program is available on almost all of our Cigna plans, okay? And the only one it is not on is the Enhanced Diabetes Care Plan, and that's because the insulin benefit gets even better, okay? And we'll talk about that in a few slides. Looking at our tiers. So we have a pharmacy benefit design that is 5 tiers instead of the usual 4. And this is because we split up preferred, generic, and generic. Okay, so think for our tier 1s, $0 to $3. Tier 2s, more like 10 to 30. Now new for this year, you're going to see more tier 3 copays from us, right? Used to be co-insurance city from tier 3 on. Now, in general, you're just going to see more copays in tier 3. And in certain markets, like Illinois, for example, an occasional tier 4. Also, while this slide is up, calling out our formulary, okay? This is your source of truth with us, right? Like, can't tell you how many times a broker texts me, oh, is this covered? And I say, did you check the formulary? They'll say yes. And I'm like, yes, it's covered. Or no, it's not. Or a prior auth is needed. The formulary is your source of truth. Moving on down, we have the My Personal Champion program. So this is where, someone going through a complex medical administrative situation, right? They don't want to call in and explain their story every single time when they need help. So this is that coordinated help with it, right? So they're calling in and talking to the same person every single time that understands their situation, okay? And they can get to this program by calling the number on the back of their ID card and asking about it. Another program they can call the number on the back of their ID card for is Cigna One Guide. So this is like enhanced customer service, personalizing it, right? Maybe it's someone with a chronic condition, managing life-changing diagnoses. They need extra support. Maybe they're worried about cost. They want to find affordable care, avoid unexpected bills. Or maybe they just want their benefits simplified for them and helping them understand them, right? This is going to be the go-to for them. And once again, they can get to One Guide by calling the number on the back of their ID card. Hopping over to Healthy Rewards. All right, so this is just another, like most value adds, letting you know we have this in case someone asks. So fitness club membership discounts, nutritional home delivery meal service discounts, financial coaching, wearable fitness devices. We have this, and they can get into healthy rewards via my Cigna, right? You're picking up on most things go through my Cigna, which is why you should be bringing it up with your customers. All right, saving the best for last, in my opinion, the Take Control Rewards program. Now remember, you get to this program via wellness in the top right of your My Cigna homepage. So with Take Control Rewards, this is where new for 23, they can earn up to $325 in points for that service year. And you know the drill with these. You complete actions, you earn points. The points then can be exchanged for prizes, right? Or you can just convert those points to cash and get a reloadable debit card. Calling out how easy this can be. Okay, they go to wellness. They're prompted the first time to take this initial health assessment. It takes maybe 3 to 5 minutes of their time, and they instantly earn 750 points, aka $75 that they can begin using. I don't know about those of you on the call, but if I could earn $75 in 5 minutes, I would do it. Who wouldn't do that, right? That's just easy, nice cash we'd all like to have. I would be talking about this with any current or future Cigna client. Okay, let's say they go in to see their PCP, right? They document their visit. That's another $50 right there. So $125 easy right off the bat. I know everyone has these, but I'd like to think this is pretty easy money to get. Okay, then they go, they do their virtual care, they get a flu shot, right? The points keep adding up. So then let's say they go into the rewards website. Our reward website looks like a mini Amazon, okay? Over 650,000 products to pick from. You see some examples up there on the slide. Now, with that being said, I know the debit card's the most popular one, and it's reloadable. They go in, they have it be sent to them, it's mailed out. Maybe they go earn more points, want to turn those points into dollars. They can just reload that same debit card. And they can use this debit card on literally anything they want. I had a broker who's a customer have her debit card, like her Cigna dollars, pay for her birthday party. Like, just insane. They can use it on anything except firearms, alcohol, and tobacco, which should make sense for a health insurance company. And then just one last call out, and I mentioned this before. This is a great go-to for someone who is maybe totally all in with Cigna, but another carrier is a little cheaper, and that's what's holding them back. This covers that cost difference. In a state like Mississippi, our drug copays aren't as competitive as the other carriers. This is a nice program to talk about when they're like, oh, well, Better's $5 for a tier 2, you guys are 10, okay? This is how this can be used. All right, let's talk dental just a little bit. So this is the lay of the land across almost all states right now. Now, I want to call out for those of you that do dental, you're quoting and enrolling within the Express app broker portal. There is a third row here in certain states right now. So we came out with the low-cost dental line, lower premiums than what you see up here, higher dental benefit dollars, low deductible, wider network than the Cigna DPPO. It's not on here because we're going through a slow rollout with this product and only adding a state here or there each month. At this point, it's only available in like 3 states, and off the top of my head, I know Mississippi, and I want to say Indiana are 2 of those. So, you know, if dental is a big thing for you guys, something we can take a lot further, I think, right? You know, we'll do a bigger dental training maybe sometime in the spring. Now, focusing on what you can find in most places, we have the OG original dental products in the first row, average premiums left to right. You can see the dental benefit dollars, the dental deductibles. we will waive waiting periods on all of our dental plans on class 2 and 3 with proof of prior coverage for up to 12 months. Must have at least no more than 63 days in between the two policies. Now looking at the gem of the top row, it's the 1500 which covers orthodontia. Available for adults and children. Now with orthodontia, they will have to wait the 12 months no matter what to get those braces. Bumping down to the second row, comprehensive coverage, right? They want the dental vision, hearing all in one. This is your go-to. See the average premiums up there, the dental benefit dollars, no waiting periods for dental and vision, as well as no deductibles, okay? Pretty nice. Calling out the gem of this week, the 3500. The 3500 covers implants. Now, before this came out in May of this year, the number one question I got was, does Cigna cover implants in terms of dental, obviously? And it's just been so nice 4 months into this to be able to say yes with a nice big smile on my face. So that plan's great. Similar to the orthodontia though, they're gonna have to wait the 12 months to use the implant coverage, okay? And then just one last plug for the national premiums. These are national average premiums you see. Depending on where you live, these are gonna significantly vary, okay? So like in Mississippi, I call that state out a lot because I manage it. The average premium actually for the 3500 is like $42. Now calling out Chicago, my homeland, the average premium here is $72. So you can just see how this can significantly vary, and it's important to run quotes and compare for where that client lives. All right, Dppo Advantage. So this applies to the 2 dental product lines we just talked about. Okay, so with the Dppo Advantage, you can see the dentist count, number of locations available. You can use the same provider directory you use for medical to search for dentists, and it'll say Dppo Advantage. Now, the cool thing with this is no balance billing, right? Contracted rates. So if this were a dental training, I would pull up a chart and I would show you how much the service cost without insurance, maybe using a PPO, and then using the Dppo. And you would see from each different level, right, saving at least $1,000 or more as you work your way towards the Dppo Advantage. So just pushing with dental, utilizing this. All right, the lay of the land for 2023. All right, we have 3 new states, if you didn't already know, for this year. So we got Texas, adding Dallas, Fort Worth, El Paso, and Lubbock. In Indiana, we got Indianapolis, South Carolina, Charleston, Myrtle Beach. Okay, and then we're expanding in Mississippi, up north in DeSoto Olive Branch outside of Memphis. In Georgia, we're expanding in Savannah and North Athens. And then in North Carolina, we're expanding in Greensboro. All right, let's look at the plans. Now, we're not going to review all the plans in every state. That would be absurd. You know, if there's certain states you're interested in or networks in each state, right? You can find that information in the broker portal, documents and forms. If there's just like maybe out of our 16 states, 8 or 9 that really applies to this group and what you're focused on, you know, I can email those. Calling out plan highlights across markets. So this is a great slide because it breaks this down in the sense of like what's available and calling out the exceptions. So I mentioned $0 offerings. So let's look at it closer. So we have $0 ACP plans in at least each metal in all of our states except Georgia and Mississippi. That's nice. Now new for this year, a $0 combined medical and drug deductible in Florida, Tennessee, and Texas. Also calling out, $0 med deductible only. This is something we tried out last year. It's here to stay. You're going to see this in all of our markets now except Kansas. And to be honest, Kansas is not a state we do that well in, so it's not a big deal. Drug copays we talked about. Competitive drug copays now in tier 3 and 4 we talked about. First dollar coverage on specialist PCP urgent care on almost all our bronze plans. So straight up, our bronze plans are going to all really seem to be expanded bronze plans now. The only nuance there is going to be the HSA plans, which are always heavy coinsurance. And with that, right, we'll have bronze HSA plans in all markets except Mississippi, with Pennsylvania also having one in silver. We got our gold ICHRAs coming in. You see where those are at. Silver off exchange. You see where those are at. And then at this point, you all know that CMS cracked down on ACA just a little bit and requires some CMS standardized plans in each metal where each carrier has the same plan. So to differentiate Cigna designed plans versus CMS standardized plans, we're calling our Cigna Simple Choice so that you know what Cigna created versus what is CMS, okay? Now, in markets where the price is right, okay, they're going to be on top. So this is just what I'm finding. So for very price sensitive clients, they might be drawn into Cigna Simple Choice because it's appearing before the Cigna Connect. And that's just helpful for you to know and maybe study those plans. One last call out, probably the best point on this slide in terms of price. So we're expecting $0 bronze plans in about 75% of our markets at that 100 to 200% FPL. We're also expecting $0 silver CSR 94s in about 25%, hoping this even becomes like a 70-30. We didn't have this talking point last year, so you can see my excitement about it. Okay, we talked about the diabetic benefits getting even better on this plan. You can see why. So we have $0 preferred insulin on our enhanced diabetes care plan. Now for this year, you're going to see the diabetes care plan in bronze and silver in all of our markets. And in some markets, you will even see it in gold. Okay. Also, $0 diabetes related equipment on this plan. So think about the insulin pump. Think about a Dexcom sensor or a Libre sensor. $0. Okay. Now for that feature in particular, what I've discovered is a prior authorization is typically needed to get that Dexcom sensor for $0. Other $0 features to call out again. Nutritional counseling and routine podiatrist visits. Now with this one, only the diabetic on the plan can enjoy these, right? So let's say a mom enrolls her family of 4. Only she can enjoy the nutritional counseling. Even though me personally, I would love to enjoy $0 nutritional counseling. Okay, Cigna Enhanced Asthma COPD Care Plan. You're going to see this come out in bronze more this year, and it's in all of our silvers. So with this plan, right, another example of Cigna trying to make healthcare more affordable for a specific chronic condition. And you're going to see $0 features here with pulmonary rehab, sub-oxygen, pulmonary function test. Where this plan gets really great, though, comes down to prescriptions. So we see a $10 copay deductible waived for the generic asthma COPD prescription. Even better, $20 copay deductible waived for preferred brand asthma COPD prescription. So think about the Brio Ellipta, Flovin HFA. You know, on average, even with a good RX discount, these cost about $200. So on this plan, we can save them over $100, close to $200, right on their medication. This is a prime example. Again, like obviously this plan is going to be a bit more expensive than our low cost silver, right? it's worth it. The price difference is worth it. If on this alone, I'm saving them this much a month on their premium or on their medications, right? That should make sense. And just in general, guys, right? We talked about the asthma, the diabetics, okay? When someone calls in with these chronic conditions or you're having an appointment with the client with these, in general, I would talk about Cigna. Just see if it's an option. I know sometimes the doctor's got to be right price, but I would be calling these plans out. All right, broker resources. So for those of you that use your Cigna broker portal, you probably noticed it changed in the last week and a half. So this is meant to make it easier to do business with all of Cigna and streamline across business lines. So you now log in and let's say you do Medicare Advantage with us, Med Sup, commercial maybe. It's like, what do you want to do with Cigna today? What book of business are you trying to enroll or look at? What quote enrolling are you trying to do today? Okay, you come in and you pick. Now, focused on IFP, this is what that homepage now looks like, okay? So just, emphasizing that the functionality of the portal really hasn't changed. You see the same columns now over here on the left as you did before. It just looks different. So if you clicked on medical here, it would take you to our Cigna Health Sherpa page where we do on and off exchange enrollment. If you click on dental, it's going to take you to Express app, which as of May is our new dental enrollment platform for all of our dental products. I don't know if anyone's used it yet, but it's pretty nice. I mean, you put the zip code in, their age, right? And you get quotes for all of our dental plans. And then you can compare them, pick the best one, start to finish, make the payment, right? Everything's done there. And then within 24 hours, they're showing up in your broker portal. All right, this is just emphasizing that a little bit more. Now, let's say we go to the Resource Center. This looks the exact same, okay? So that has not changed. Create that producer link if you use it. Instructional materials, documents and forms, same thing. And then under documents and forms, that's where you would pull our plan comparisons, for example. And that's what they look like. It's also where you would go to pull up marketing materials. So maybe you do some events, you like to co-brand with us. We have co-brandable flyers available in the portal, and you can add your contact info. Quote and enroll. We already talked about how we, at least for Cigna, you might have your own use Health Sherpa for on and off exchange. Billing and enrollment. The effective dates at this point, open enrollments until January 15th again. I'm sure other carriers have covered this. Payment deadlines. This isn't changing with us. You can go back and look at this slide. We will send this deck out. But you know the drill, right? For binder until the effective date or up to 30 calendar days after. Off exchange required at submission. Ongoing, it's going to be the last day of the month before the coverage month for the bank drafts. And then for off exchange, it occurs on the 5th of the coverage month for those bank drafts. Payment information, ways to pay. With Cigna, credit card's not an ongoing payment method. You can use it for the binder, but that's it. Okay, so you enroll that customer, you maybe go to this link up here on the right to make their binder payment. My 2 cents, if you could get them to set up for auto pay with the binder then and there, they're off your plate, right? For the whole year, shouldn't be worried about lapsing. I know not every ACA customer wants to do that though, right? Maybe their tax credit changes or income changes. 1 month they get 500 taken out when they plan for 50. I get it. But if a certain customer is good with this, I say do it. Now let's say they just do the credit card. how do they do their ongoing beyond that first binder? They can call, they can mail it in, or my favorite out of these options, mycigna.com, pay my bill. One call out with this, they make their binder payment. They got to wait about 5 business days for the payment to process to register for MyCigna. You know, with holidays during open enrollment, my rule of thumb is tell them 7 to 10 days, just because you never know. And then from there, they create that MyCigna. And so this just shows, right, the member login for MyCigna. And then when they're registering for the first time, they're going to click on member registration here on the left. It might ask for the member ID number. Unless their card has come, which it probably hasn't, they can use their social security number to get in. Then they're in MyCigna. They scroll down to the bottom, click on Pay My Bill. This takes them to their billing dashboard, right, where they have the option to, you know, see their payment history, make the payment, modify, cancel, all things like that. We already talked about when ID cards come. Other call out on this slide is that we just accept child-only apps, but we must have one application and one payment for each child. And then, you know, they make their binder, they wait those business days to create their MyCigna, they get a quick start guide, how to use their plan. You're telling them about Take Control rewards, right? And then they're hopefully on their way to being a happy, satisfied Cigna customer. Okay, renewals. Very straightforward. Must select plan by 12/15 for 1/1 coverage, 1/15 for 2/1. They can go online to those websites to renew. You could do it for them in the broker portal. Or if they don't do anything, you know, they're just going to auto renew. They just have to keep making their payment. And then, of course, you know, make sure you account for any income changes with your clients, address changes maybe. And then in terms of renewal letters, what they're getting, so they'll get either 2 types. One's their plans available, you know, they don't have to do anything. The other is, you know, discontinued with mapping, and they'll be mapped to a new plan for 23 that is most similar to the plan that they were on. Cigna for brokers, you can pull a renewal summary, make sure you select it's for January for OEP, and then you can export the report into Excel. And then this just shows you all of the data you'll see in that renewal summary. Should get you everything you need to be able to renew. Market level talking points. So coming up on the grand finale of this presentation, guys, I told you I was quick and hopefully thorough. And then once we get through this, I'll just peek into the chat and Q&A box, since I haven't been able to do that yet, and answer any questions or address any comments that you have. But jumping into the most important part of this, right? Where is Cigna hot? All right, so these are our hot pricing market, and then with the our hot network market. So if it's up here on the pricing list, it means we basically have a low cost silver or just about in that market. Okay, so this is where it's going to be looking really good. And I'll dive in a little deeper in these next few slides. Hot network, this is where we just don't get any negative feedback, really no suggestions. They love our network, we're good with it. And it's just something that's a selling point for us. So I like to have a little fun. And I took those lists and I was like, let's make a little report card, like states by competitiveness. So this is comparing price network, you know, some prices feel totally locked in. Others, you know, kind of feel like we'll see what happens window shopping, but we're feeling confident. So Georgia, we love Georgia this year. Okay, we're going to have low cost silver in Atlanta. Holy cow. And we have a great network. To give you color, Oscar of low cost silver last year, they went from like 700 members to 75,000. And we're Cigna, with a brand name and a great network, we're expecting to just kill it there, okay? Texas, second low-cost silver in Dallas-Fort Worth, to Bright Health, okay? So that's huge. One, because, you know, there's a lot of shakiness with Bright Health right now. Is someone going to buy them? Are they going to go under? Right? It's shaky, right? And brokers are nervous about it. So being the number 2 right behind them, I view that as almost being on top, right? We see this as a huge opportunity. And just keep your eyes open in the news for what might happen with them, specifically in Texas and Florida. You know, I can't like put pen to paper with this. I'm just trying to share Rumorville and what my manager is telling us, right? You know, there's rumors as of a day ago that the DOI might kick Bright Health out of Texas and Florida. You know, don't take that as facts yet. It's just rumors, but it's enough of a rumor where my manager was like, make sure you mention this in your training. So here we go. Going down the list, Indiana, low-cost silver in Indianapolis. This one's locked in. Rates are public. I've had brokers call me, be like, Cigna looks really good this year. The network's just okay, though. We just have community, but it should be enough to make a name and grab some membership. I'll talk about the others on the next couple slides, but you can see the breakdown. Hoping to have more clarity on where we're going to fall with Florida soon, now that we're into October. And then just the back half. Honestly, up until really 12-ish, definitely 13, there's plenty of reasons to sell us in these markets, and I think we can do well. You'll see in a second why Utah's a bit tougher. Still think we can do something, not a lot. Pennsylvania's tough. I mean, we'll talk about that too. And then with Kansas and Missouri, honestly, like good luck, but it's just really hard to sell us there. I mean, even Missouri, right? Let's just go to the next slide. You see a lot of red up there, right? I just don't think it's going to be very possible. So kind of zoning in on Missouri, because I believe there's going to be some of you on this call that have business with us there, do a lot there. So we're losing $60 million a year in this market. This is just me sharing you what's going on the carrier side for you to understand. That's a lot of money, right? But Missouri is a loyal market to us. We don't want to pull out and wait the 5 years to come back in. So we're taking drastic measures to be able to figure things out and hopefully enter with something stronger than we can actually turn a profit on. So we're skyrocketing our price, cutting plan offerings down to 1 in each metal. The BGC exclusivity, that's tentative. I really thought with what we're doing, another carrier would want to partner with them, but we might still have this going for us. So while like I really anticipate Missouri to be bad and we honestly want to shed membership, if we don't lose the BJC exclusivity, it could be really interesting there. So just keep your eyes peeled. And if anyone low-key hears about another carrier in Missouri that is partnering with them, let me know, because that would actually be good news for Cigna, surprisingly. Okay, talking about Illinois. So Illinois is the one market where we have 2 product lines. So we have our Connect product line, and then we have our Northwestern co-branded product line called Plus. So Connect, we joke, let's disconnect with Connect because the price keeps increasing and the network is pretty crappy, like very crappy. Like it's really hard to sell that one. So in Illinois, I focus on Plus, which is great, except for the fact that similar to Missouri, Plus runs the county that I live in, Cook County, where the city of Chicago is. So to keep Plus around, but make it, you know, a little better, I guess, we're taking it out of Cook County. So no Cook County resident for 23 can enroll in Northwestern Plus. Now in the other 4 counties, Lake McHenry, DuPage, Kane, those Plus customers can still go into Cook County and utilize the Northwestern facilities. And so the only bright spot of this whole situation is that we have low-cost silver, or expecting to, in Lake and McHenry County. So at least Plus can still continue to do well there. Indiana, we already talked about. Pennsylvania. So this is our second year in this market. They were so happy we were coming in, great brand awareness, and then they saw our network and they saw our price, and they were like, what the heck? Unfortunately, the network's not changing, and the price isn't fantastic. I'm hoping we're going to see some great changes for 24, but right now this is just the state of state. Going to the next slide, Virginia. Just a solid Cigna state with great brand awareness. I call it one of our veteran markets. Low-cost silver in Winchester. North Carolina, we got second low-cost silver in the Greensboro market, partnered with Moses Cone. This is the largest market for Cigna in terms of like coverage, where we cover 80% of the state. So this is just nice. Anytime you're talking to someone in North Carolina, you could probably bring up Cigna. South Carolina, hoping to have the low-cost silver in Myrtle Beach. All right, Tennessee. This is our best Cigna ACA state. Largest market for us in terms of membership. They love us there, even when we don't have a great price, right? We have a statewide network solution, can go to Vanderbilt anywhere, and this year we're hoping to have low-cost silver, at least in the Tri-Cities. Georgia, we hammered it in, right? Also going to have second low-cost silver in Savannah, Northeast Georgia, and Athens. Mississippi. Oh, I love this state so much. We did so well last year. Brokers made up 75% of our business. We took about 40% of the market share along the Gulf Coast. The price is going up, about 7%. You know, window shopping is really going to help me gauge on how well we can still do here, because we're really building up a good presence. We have a nice network along the coast, adding another hospital for next year. Network differentiation in our expansion counties. So we're no other ACA carrier up to this point, right? Ambetter and Molina at least have had Methodist in their network. So this is nice for us coming in to the North Mississippi, DeSoto, Olive Branch area to say, hey, if you want to go to Olive Branch, you now can with Cigna. Florida, really strong network in Miami-Dade area. You can see the nuances there. So all those hospitals listed, Ambetter, Oscar, Molina, and United currently do not have any of these hospitals. Now, you know more than I do at this point, so maybe some of that has changed. But this is, you know, the lay of the land, at least as of right now. Kansas, not much to sell, but if I had to go to Kansas to sell us, these are the call outs I would make. Texas, we talked about, right? Second low-cost silver, Dallas, Fort Worth, hoping to give the Blues competition in El Paso and Lubbock. All right, the West, Arizona, only ones with Banner and Dignity facilities side by side with Banner Health PCPs also in network. That might have changed. Again, you know more than I do. Colorado, one strong network, statewide solution similar to Tennessee. We just have a nice brand name going for us there. Utah, we got some good and some bad. We're removing primary children's hospital in a market where the average family size is like 6 people. Not great. But, you know, we have a nice $0 med deductible bronze plan coming out that I know the brokers there that I talked to are pretty excited about. So we'll see how it does. Then just some lay of the land in Georgia. Large rate increases across the board, which is great for low-cost silver, Cigna, right? CareSource exiting in the Northeast, you know, hoping to do well there. Indiana, CareSource and Ambetter, 2 most popular ACA carriers there, are taking rate increases. CareSource, low-cost silver, number 1 is going, I should say number 5 up there actually, out of the carriers in the Indianapolis area. And then that's it, guys. Tried to go quick, but get it all in and still be thorough. I'm going to leave this slide up if you want to drop my email down, broker support, quick links. Again, we'll send the deck out and take a look at the Q&A. Is there an age limit on the hearing discount? No. Please explain prepaid debit card. It's not a prepaid debit card. Well, I guess I'm trying to understand this. So let's say they earn the $75. They go into the reward website, right? They have the debit card be sent to them with the amount of points that convert to dollars that they want on that debit card, right? So let's say I get my $75 after taking the health assessment. I go and request that debit card be mailed to me with the $75. Now I go see my PCP. I want to go convert my PCP points to dollars on my debit card. I do that in the reward website and it reloads. So the network hospitals in Atlanta Metro, we'll make sure you get the Georgia network flyer. It breaks up facilities available by county. You probably read, the Georgia side, right? I'll put that up for you for a second with, the names that we have going for us. What does LCS stand for? Low cost silver. So the cheapest in the silver metal, right? Northwestern is very good. Low cost silver, yes. I see Cigna rewards. Oh, I was referring to premium payment. So that, I don't want to go all the way back to this, but we'll do it. So here, a prepaid debit card, I guess that most brokerage accounts have debit Visa that has rewards. So for the making a payment, a prepaid debit card will take. Sorry, I hope that answers your question. Can premiums be paid by credit card? No. Okay, just the prepaid debit card. Only the binder can be paid with the credit card, okay? Okay, you got it, Elizabeth. We're on the same page. Can we get a copy of the presentation? Yes. Where will all these trainings from the CIC be available later? You guys are going to get this deck. We're going to send it out. Let's see if there's any others. Answer live. I think we covered it all, guys. Any others? Feel free to sneak them in.
There were a couple of questions also in the chat box. I don't know if you can see those.
We do quotes on Quote It. If that's the enrollment platform you guys use, I'm new to managing this relationship. Yes, it would be set up then. We are on Quote It. Not sure if our dental is though. I don't believe the dental we talked about is. So you're going to have to go through your agent broker portal, Quote and Enroll Dental Express app to do any of our dental plans. How do you get to the reward website? When the customer creates the My Cigna account, right? It's in the top right of the My Cigna homepage. Okay, when they make that account. Copy of this presentation, yes. So with the client renewing for January effective, if they just want to auto renew, if they're set up for auto pay, then it will do that. If they aren't, then they'll just make their payment like they usually do. Just again, if their income changes their zip code, make sure you remember that. Lisa wants to see the enrollment dates again. We can do that. There you go. Those marketing materials in your broker portal, documents and forms. We could also start to email those out if this is a team that utilizes those more. It's kind of hit or miss sometimes. But the Take Control Rewards one's kind of great to advertise that with a flyer, co-brand with it. For contracting, yeah, guys, keep going with HST contracting or whatever process you have. They usually come to me or they work with our broker support team. You have to have diabetes to enroll in the Enhanced Diabetes Care Plan. Yes. You must remember, the diabetic to utilize those $0 features. Off is a new login. So we called out where to go for the rewards program. Will it cover implants on teeth that are not there anymore? So there is a missing tooth clause with our plans. Okay, so like if you have a missing tooth before enrolling in the plan, it's not going to cover that. That's pretty standard usually with dental insurance. But if you lose the tooth and you're on one of our plans, you know, there you go. Okay, got it. And any others? I think we are good, guys. Thank you so much. I know we went over, but
no, it's good. This was so informative. Really great stuff. You've got some definite competitive advantages in certain states. I love those charts. And just to remind everybody, you will get a copy of this and you'll get a link to the presentation. So just sit tight as we edit all these and shoot them out to you. Thanks, number one, to Natalie. Really appreciate your effort here today. To all of our attendees who stuck it out for 3 whole days, thank you so much. Nick, for being a great co-host. Really appreciate it. I hope everybody has a fantastic open enrollment. Any questions you guys have, just let us know. We're here to help. Thanks, everybody.